Dr. Faheem Younus. He is a professor of clinical medicine at the University of Maryland, and he joins us now live from Baltimore. Thank you very much, Dr. Younus, for joining us here on TRT World. Now, to start off, explain to our audience in the simplest possible terms, what is this Paxlovid pill all about and how does it work?
I think it's a great breakthrough for us because current stage we do not have a pill to treat COVID that attacks the virus itself. Current treatments manage the symptoms largely. This pill reduces the replication of the virus, can be taken at home for 5 days, and will have about 90% efficacy. So I don't think this is a replacement for the vaccine. The best strategy is still to prevent the infection, get vaccinated. But if you have a breakthrough infection, if you're immunocompromised, this will be a great help to keep you at home and not let the disease progress so you end up in a hospital or a ventilator.
Okay, now, Dr. Younus, you have been closely following the pandemic since day one. Tell me, to what extent do you think this pill is going to help in ending the pandemic?
I think it will be a multi-layered strategy. Nothing is a silver bullet in itself. What we have learned that a lot of things done together will end the pandemic. Number one is vaccination. Number two is getting tested if you feel sick. Number three is wearing a mask. Number four is avoiding gatherings and social distancing. And similarly, this is one more step. And then equitable distribution. All of that combined will end the pandemic. My worry is if we continue to have so much inequity between resources, then this pandemic may end in one country, but not globally.
Okay, and Dr. Younus, before I let you go, I want to ask you about the Omicron variant. There seems to be a lot of confusion about this variant, uncertainties over what we know about it and what we do not know about this new variant. So what do we know about this variant as of now?
Right. So I think the whole pandemic at this stage has gotten very complex, and people, particularly experts, should try not to predict with too much certainty. I think what we know for sure is that it is more transmissible. Cases are rising in a lot of countries. What we also know that two of our monoclonal antibodies will not be effective against it. What we also know is that current vaccines provide weaker protection, not zero protection, but it can break through 2 shots. Therefore, a third shot is necessary. What we also feel so far, most studies are indicating that it's causing a less severe disease and may have shorter spike of the wave, but that doesn't mean that we should become complacent because it can overload the system. Where I want to leave everyone, this variants will continue to change and we will never know everything about them, but the principles of prevention remain unchanged. Wear a mask, get vaccinated. If you're not vaccinated, get your third shot if that's available in your country, and avoid risky situations. Those fundamental principles are going to end the pandemic. Just because there's a new variant, we should not feel pushed to come up with a new strategy. We need to stick with a proven strategy.
Now, Dr. Younus, just one more question here about the third shot, which many are calling the booster shot. How effective is it against the Omicron variant? Because there are reports out there which say even a third shot does not protect you from contracting the Omicron variant.
Right. So again, we need to tell people that medicine doesn't work in guarantees. You will always find some cases. It's a game of probabilities, not guarantees. And I'll give you a few numbers. According to one study, Omicron Pfizer vaccine's efficacy drops to 55% with 2 shots, and Moderna's efficacy drops to 37%. And when you give that person a third shot, that efficacy goes back to 70, 80, 90, depending upon the host. Nothing will be 100%. You have to simply reduce the probability, and that is how we get to the end of this pandemic.
All right, Dr. Faheem Younus, it's always a pleasure speaking to you, sir. Thank you very much for talking to us here on TRT World.